All right, let's go ahead and get started. So welcome everyone. It's good to have you here. My name is Peter McKnight. I am the head of school at Charles R. Drew Charter School. This is my second year in the role of head of school. So I think I've actually spent more of my tenure in the COVID-19 pandemic than I have spent out of it, and certainly learned a great deal from that, and have been particularly proud of our team as we have navigated virtual learning and now a transition to hybrid learning. Prior to that, I was the founding principal for the Drew Charter Senior Academy, our high school program, and prior to that, the founding principal for the South Atlanta School of Law and Social Justice. So I'm excited to have folks here. As many folks may know, Drew Charter School works in conjunction with the Eastlake Foundation, and the Eastlake Foundation, with the support of countless public and private partners, has led the holistic revitalization of the Eastlake neighborhood in Southeast Atlanta for the last 25 years. The foundation operates and facilitates programs that provide equitable opportunities for residents at the villages of Eastlake and families at Charles R. Drew Charter School to break the intergenerational cycle of poverty and build brighter futures. Drew Charter School and our early learning partners serve as the cradle to college education pipeline within this holistic Eastlake neighborhood revitalization. And so we're certainly glad that Eastlake Foundation hosted us for this event today. And it is my distinct pleasure to introduce Dr. Deneta Sells. Dr. Sells graduated from Harvard College in 1992 with a degree in sociology. She received her medical degree from the University of Tennessee College of Medicine in 2003 and completed her residency in pediatrics at the Morehouse School of Medicine. Dr. Sells opened Intown Pediatric and Adolescent Medicine in September 2006. Dr. Sells' personal philosophy is to be a true neighborhood doctor, involved in community activities, offering convenient appointment times and after-hours advice. She is a member of the American Academy of Pediatrics and participates in the section on early childhood education and childcare, as well as the section on complementary holistic and integrative medicine. Dr. Sells lives in Druid Hills with her husband, Brian, a voting rights and election law attorney, and their baby girl, Sarah Elizabeth. They're big baseball fans, enjoy sampling Atlanta's great restaurants and going out to hear live music, and can usually be found Sunday mornings at the Flying Biscuit counter in Candler Park. And as a particular note here, both of my boys, Sam and Max, 4 and 7, are patients of Dr. Sells at Intown Pediatrics. And so I'm excited to get a chance to talk to you in a different capacity today, Dr. Sells.
Well, thanks for having me.
Absolutely. Absolutely. Just so folks have a sense of our purpose today, really the purpose of our conversation now is to support families as they're weighing the risks for your children and your family as we resume in-person learning. So at this point now, there are many schools who have transitioned to some form of in-person learning, and there are schools that are in the midst of that transition now. Obviously, information is fast-paced, and there's a lot coming out, and we've all had to a certain extent, become somewhat public health experts. So it is helpful today to have a particular field expert in that area to support answering some of those questions. So to kick it off, I think the biggest question generally, Dr. Sells, I think is what are the key considerations that parents should be considering if it's appropriate for their student to return to some sort of in-person learning. So maybe we can start with that.
Sure. I think there are a number of key considerations, probably the largest of which are the risks for your child and your family. The good news, if there's any about this pandemic, is that for young children, most of them have very mild illness, very mild symptoms, if any, and particularly those in elementary school. I think that it's trickier as you get into high school. Pretty much adolescents act as adults. And so then you really have to consider their risks, their personal risks. Asthma, are they have other underlying medical conditions, obesity. Unfortunately, even young adolescents of color seem to have more symptoms and more risk of disease, just like adults do. And then the risks in your own home and community. Do you live with a person who's medically compromised? Do you have an elderly person in your family that lives with you or you come in close contact with every day, and what risks you might bring in those home? Those are really the main ones to consider, I think, for most families.
And is there, again, in those situations, if students have those particular considerations, is that kind of a no-go for them, or do you think are there considerations on the school side that maybe can help inform that decision? What information maybe should families be asking about the steps that schools are taking that would then, in conjunction with those risks, help with the decision?
Great question. It definitely depends on how the schools are handling social distancing, how they're handling masks, how the age of their children in the grades. I think one of the encouraging signs in all this too is that most of the spread of the disease really seems to be happening outside school settings. And so recognizing that some of it's happening, most of it's happening in social settings, unfortunately outside the school building. There are places in the country where children have been back in school this entire school year, and they're really seeing that spread happening outside the classroom. So it's really, do we see what's happening in our community? How much spread's going on in our community as well? Is our child's school doing a good job about mandating masks? How are their teachers distancing amongst themselves? There's been more spread amongst the adults in the schools, those kinds of things. Those are good questions to ask.
And I know just on the school end, so from a school perspective, Drew, we've thought about layering these different layers of mitigation strategies on top of each other. So our perspective, none of them are perfect, but they're kind of like layers of Swiss cheese. So you layer on Swiss cheese, and eventually most of the holes are gone. So for us, that's been physical distancing. So again, when we first opened for in-person learning, that was 6 feet. I know at this point now there's been new guidance around, the potential safety of 3 feet. And would maybe ask you about that in a second. Mask, mandates have been really important. And it seems to me, I'm curious from your perspective, it's seeming like with the physical distancing getting smaller, it's putting more emphasis on the mask wearing and the fidelity. Is that an accurate kind of understanding of where the science is going with this? It
is. And the other, I think, caveat about the 3 versus 6 foot recommendation too is if 6 feet is too difficult, then it's better to have 3 feet and children in school than to say, oh, we can't do 6 feet and therefore children shouldn't go back to the classroom.
Right.
So, I mean, it's a little complicated. I mean, I think the recommendations are still 6 feet is great, but we see that 3 feet is tolerable, if that makes sense. And then that with masks absolutely really decrease the risk tremendously.
I think you also highlighted an important point there is that and this I think is the challenge, is there is a risk associated with going to school. There are also risks that are associated with staying at home. And so that is part of, it seems like, the calculus that the CDC has made, is saying, okay, certainly it's not saying that there are no risks at school, but there are, again, certainly risks of remaining at home. Could you speak a little bit to I know American Academy of Pediatrics has spoken to that and just the concerns about that. What are the concerns about that, or the risk on that side that, you should consider about, staying virtual or staying at home?
Right. Well, we certainly have seen just how much screen time children are having. There are new studies that I think came out last week that looked at how screens are affecting children's vision and fatigue with their eyes. There's, of course, the social element that children are missing. There are huge educational gaps that are falling. Some children just are not learning via the screen. The demands on the families and the homes about Is there a parent there to help that child with the screen? Is that, a lot of our kiddos have parents who are essential workers and aren't able to be at home. So where are they doing this virtual learning? How is that happening? Are they having more risk going to the YMCA or something like that to do a pod in a public place? And then we're seeing big increases in children's weight over the past year. Just they're very sedentary, and the emotional and effect on our kiddos, missing school, missing their friends, leaving the house, getting out of the house. It's really been a tremendous burden.
I think I think a kind of related question to school is that parents who are recognizing that need to get outside, also the need to socialize in general. So school is certainly one option for that. I think one of the interesting things that I've seen is that the reason schools have generally been pretty safe is that we're actually pretty used to like having rules and procedures and following them in comparison to many other public places where it's a bit more willy-nilly. But in schools, by and large, we can implement processes and procedures and folks will generally follow them.
That's a great point.
But I think also families are also considering, okay, what other options do I have for my students? So, thinking about play dates outside, things like that, what's the sense of other activities in addition to school that might, provide outdoor activity, exercise, socialization, any sense of how to evaluate those? I know those we've gotten a lot of questions about the safety of those types of activities in addition to school, or also maybe in conjunction to school. If my student is in school, should they still participate in those types of activities outside of school?
Right. So I remember when the pandemic first started, we got a lot of questions about, can my children still play outside in the neighborhood? And there was a great article that said, this is not a snow day. So it's not, everyone pile in your cul-de-sac or at the playground with everyone from the neighborhood. That being said, I think a year later, we have some better understanding about how the virus is transmitted and how much risks go down outside, how much risk you can mitigate wearing a mask outside. And so I've been telling my families that you want to know who your child is playing with. You want to make sure that child himself is also healthy and that their risks are low when they're coming. They haven't been exposed or they're not supposed to be isolating or quarantining from an exposure, and that they should be pretty safe playing outside if they can at the same time be mostly socially distant. So they play 3 and 6 feet apart. They shouldn't like run up and hug each other and take their masks off and eat together and things like that. But that being outside with close friends whose risks you all understand and discuss freely and openly, everyone agrees that is an acceptable risk is to help our children just deal with this a lot better.
I know one strategy that we've also used at Drew is testing. So we required all of our staff to test. We've really strongly recommended that all of our students test, and actually we've been able to facilitate folks, our families and students, to be able to test for free on site with us, and generally coordinated that with rapid tests right before students return. So the weekend before they return, they're coming, they get a test. Is that, I just would be, curious about your general perspective around testing as a mitigation strategy. Is that also a strategy that families should be using in terms of, understanding kind of the risk for their students or other families? What role would you say that kind of testing plays in this and mitigating risks? So
the American Academy of Pediatrics is pretty strong about not doing asymptomatic testing. It's a little frustrating because I can see the benefit to when you surveil your population, you pick up some asymptomatic cases and that allows you to isolate, right? So I think it makes sense from a population standpoint for a school. If you're at home and you're not going to school and there's no recommendation to let's just go get tested.
Gotcha.
Asymptomatically just go and see what's happening, see what's going on. I also wonder though, sometimes if those recommendations were from when we didn't have very many tests, and there were some concerns about, do we have enough testing going on? But now the testing's there. And so I think it makes sense to do that asymptomatic testing right before you're about to bring a whole bunch of people together. I mean, we've seen it with some of the NCAA Final Four tournaments, right? I mean, they were doing these asymptomatic testing, and they would have had all these athletes playing together, and they're able to exclude some potential exposure because of doing that. So I think there's definitely a place for that when you're bringing a population of people together.
Gotcha. I think the other big piece in this right now, and particularly in the conversation, is around vaccines. So, we have today, all adults in the state of Georgia are, now eligible for the vaccine. Maybe starting just talking about generally adults in the vaccine, and then maybe, where we are with regard to children in the vaccine and so forth. So, what is the impact of the vaccine for adults? And again, particularly now in the context of all adults being eligible, what recommendations would you give families around vaccination?
Now that it's available, encourage all of our families the adults, senior citizens, really even our young, probably some of your high school students, if they're 16 and up, are eligible now for the Pfizer vaccine, and 18 and up eligible for the Moderna vaccine. So I encourage everyone to get online tonight and tomorrow and make those appointments. I actually drove to Athens to get mine at the end of December and was so anxious to get it. And it's such a relief to feel protected. I mean, we still have to wear masks because we don't know who around us has had their immunization and and there's still that 5% that could still contract, depending on which vaccine you get, of course. But I think it's a window to a time when we might not have to be as worried about this. If the more of us get immunized, the quicker that we can end this pandemic.
And I think you raise a good point about a lot of kind of misunderstanding around, or just confusion around, okay, now I am fully, first of all, there's 2 shots and you're not fully inoculated until the 2 weeks typically after the second shot.
That's right.
And at that point now, what can I do? And then as a family, this question of, okay, well, maybe the adults in the family are vaccinated, the children are not.
Right.
What can you engage in? What can't you engage? What behavior can you engage in? And maybe how does that impact schools?
So, well, I first think of grandparents, of course. So just the ability to, we would still wear our masks because children and young people wouldn't be immunized yet. But if your grandparents have had both doses and it's been 2 weeks after their second dose, then at least you can go. And even, I mean, I've seen recommendations that you give those side hugs, especially if you can meet outdoors and finally see and spend some time with your family. And I think that's a huge relief and just a comfort to all of us. And with schools, I mean, the teachers being able to get immunized, we've been worried for a long time about, we talk as a pediatrician, worried about how our children are going to spread disease, but we feel confident they're not going to get very sick, but we don't want them to get their teachers very sick either. And so hopefully teachers and the other support staff can get their immunizations and provide this, the herd effect that we're looking for, and herd immunity and the bubble of protection for themselves. And that'll make it easier and feel more confident, especially knowing that really it's adults who seem to be spreading it in the schools to some extent too. And so if they have their immunization, they won't be doing that.
Right.
Yeah.
Again, in my understanding of the kind of herd immunity, again, I think you said that you're kind of creating bubbles around folks who, either can't get or haven't been able to yet get vaccinated. And so that's why it just makes sense for as many people as possible to get vaccinated, because that just, again, creates distance and space between folks who who are not vaccinated and could then transmit it to each other. So, again, in that case, I'm assuming you kind of would recommend folks get it as soon as they can and so forth. So,
yes.
I mean, obviously, there have been questions about the safety of vaccines and so forth, concerns around particularly, and I know, we've done another event around specifically around the safety of vaccines, but, quickly sharing here, and I guess also particularly concerns for people of color? Were they represented in the trials? Just trust because of systemic racism in the healthcare, field and by the government historically. What can you say to folks who have those concerns? I mean, even concerns about, how quickly it was developed and whether and so forth. So,
right. I have to be frank. When we were first talking about a vaccine, I thought there's no way. It takes forever to get a vaccine. And then they said, we have a vaccine. And I said, how in the world? And so I think, I've been reassured, I should say, that one, there have been African Americans developing the vaccine. The Pfizer vaccine was developed by an incredibly brilliant young African American woman, and the studies had adequate representation. And what's fascinating is that because this has been such a devastating pandemic, the governments around the world were able to throw billions of dollars at the development of this vaccine. We've never had an effort like this before, which is why it was able to happen so fast. And this new technology, and the technology itself is not new. They've been working on these mRNA vaccines for a long time. They just didn't have the resources to really push through their thoughts and their theories and see if this works and see if this works. And we haven't had diseases that had as many cases. When we have millions and millions of cases around, then you have enough disease to test a vaccine and see if it works. So when we have diseases that only have a few thousand cases, and it takes a long time to see if a vaccine works. So you bring all those things together, and it certainly reassured me, and it makes a lot of sense as to how this could happen so fast when we have the entire world's population, the brightest minds around the world working on one problem with unlimited resources to develop their ideas, and then lots of cases to try it out. And we had a scientific miracle. And there have been enough vaccines given, even just over the past 3 months since the studies, with incredible safety data, and some sore arms, maybe some discomfort for a day or two. Doesn't match at all, of course, the burden of COVID and actual COVID disease. So I can't encourage everyone enough to as soon as you're able, get online and make an appointment. And there are vaccine angels, a lot of agencies helping people get their vaccines, trying to navigate where this is. That's been a unfortunate disproportionate burden too on some of our communities about who can get vaccines and who can travel and who can spend all day on the telephone calling these different pharmacies. But that is becoming less an issue as we get more vaccine, we have more accessibility, more access. So I'm hopeful this will turn around and this burden will be lifted.
And also, again, you mentioned before Pfizer's, cleared down to 16. Moderna's 18 or older. Johnson & Johnson's 18 and older as well. Yes. And so, a sense of what the timeline is for vaccines for children under 16. What are you hearing on that front?
So that's exciting. Moderna has enrolled children 6 months and up in their latest vaccine. I think all the experts are saying probably by the end of the summer have enough data, they think, to make a recommendation. So, and in a way, it makes sense that they did adults first. And that's how most vaccines were done. You sort of feel safer trying them out on the grownups and then stepping it down age by age to make sure that the vaccines work and are safe and for our young people. And so there are dozens of hospitals around the country enrolling children. I think Morehouse is hoping to have a local study, and we'll be having some news about that. They've asked us if we want to participate, so we're really excited that we might be able to help enroll some kids in the study too, and be able to immunize our kids. That'd be great. And children are 26% of the population, so it's hard to reach herd immunity if we don't immunize our kids. So.
All right. And so you said, I mean, is end of the summer when we have enough data to start, we think, rolling it out for students beyond trials, or, that's kind of, is there a phase after that, or when?
Right.
Best estimates of when shots are going in kids' arms?
Probably Yeah, I would think probably like January of next year is
Okay.
what I would think, is that they have start having some data, then more safety data. So they have efficacy data and then safety data for a few months, and then probably in kids' arms in the winter is what I'm hearing. So.
Okay.
Mhm.
And then again, in terms of, I imagine there maybe are some families who might be waiting for that vaccine for students to return. I mean, is that and I mean, every family makes their own decision, but should that be a deciding factor, or, again, do you have a sense that other mitigating factors could potentially clear it? I mean, it seems like the CDC guidance is that it could be cleared earlier, but how would that factor in, I think, parents' decision making to a certain extent?
Right. So the burden of disease is so mild in young people. We're talking children under 10. So it really depends on the age of your student. That and if the adults in the home can be immunized, particularly those who are more vulnerable, and then given how important in-person learning is for children, especially those children under 10, I would encourage you to consider maybe not waiting until they have their immunization to go back to in-person learning. I mean, it's obviously a family by family decision, but we're really talking very mild disease in most children under 10. I mean, it's the numbers are we're learning more every day, but that's been pretty consistent for the past year, is that young children have very mild disease and don't seem to be the ones that spread it. I mean, by and large, aren't the ones spreading it in the community. So, and if the parents and the adults are immunized, then there's no one to whom they can spread it. So,
Right.
Those parents' risks are lower too because they've had their immunization. So,
right. One other question, just maybe before we leave vaccine, the difference between Moderna, Pfizer, and Johnson and Johnson. The one dose. A lot of talk about differences in efficacy. But I'm curious. Just it seems like there's been some potentially misinformation or misunderstanding about the
right.
difference between the two of those. What would you say between options if you have the option to take Johnson Johnson versus Moderna or Pfizer?
I would say get the first vaccine you can get. We haven't really had head-to-head studies, and so I don't think it's not only unfair but just not appropriate to really compare Johnson Johnson to Moderna and Pfizer. They're different vaccines. They were actually studied in different times. There's some thought that maybe the decrease in efficacy in the Johnson Johnson takes into account the new variants, and that it's excellent at preventing what we want it to do, which is prevent severe hospitalization and death. And it is as good as those other vaccines would prevent with that prevention, which is, no one wants to get sick, but obviously we're really trying to prevent the serious consequences of COVID-19, so hospitalization and death. So if Johnson Johnson is the first one you can get, and it's actually, I think, great that it's one vaccine and not having to worry about a follow-up, and you're protected sooner. So there's that advantage as well.
Absolutely. You mentioned there the variants, and I know one question would be where are we in Georgia right now in terms of the spread and so forth like that. As somebody who checks the Georgia Department of Public Health website every single day, you give me a date, I could tell you the number of new cases per 100,000 there. I've watched the curves and so forth, but folks who are not monitoring that as closely, where are we in terms of community spread right now? There is conversation about the variants. We've seen in other countries the variants really having an impact. What is that bearing on particularly Georgia and Atlanta right now?
So it looks like the variants aren't as impactful in Georgia. Some of the northern, I think, Northeast, Midwest states are having more trouble from the variants than we are. Fortunately, it might have something to do with the weather. I was just checking today, just our Fulton, DeKalb counties are seeing an increasing over the past couple of weeks. Not as high as it was right after Christmas and the winter breaks, but starting to increase a little bit. And it looks like the county sort of calls it moderately high transmission this past week in Fulton, DeKalb, Gwinnett counties. So it's still, not where we need it to be. We still need to be super careful about where we go. It's the wearing our masks and social distancing. It's not that it feels like it's spring, and it's hard not to feel the hope that this is all over, but it's not over yet. We still have some increasing spread, and we have to be careful.
Gotcha.
Yeah.
We've kind of talked about the kind of physical, impact of the virus on students, and you've mentioned a little bit about the kind of social emotional impact on students or kids. So, thinking about families, talking with their kids about COVID-19, any recommendation about how they frame that conversation. Also, I think an interesting thing that we thought about was when we were phasing back into in-person learning. So we have hybrid learning at this point, which means we have, of our students, about half of our students opted to return to some sort of in-person learning. Of those half that are returning, they were divided into two cohorts. Some come Monday, Tuesday, the other go Thursday, Friday, Wednesday. Everybody learns virtual. If you're not in school, you're learning virtual, and the other half are continuing to learn virtual 5 days a week. So that's been our model at Drew, and that has been based on this idea of herd thinning. So trying to have fewer students in the building, we can space desks in the classroom so that there's 6 feet of distance, and so forth. And but one of our considerations as we were bringing students back in is, well, for the past year, we basically said school is too dangerous for you to come to school. And then now, you're having those kids come back to school. So any advice to how to talk to kids about the pandemic and potentially returning to school? Is there anxiety on the part of students about returning to school, and how to address that? Or also conversely, the thing we recognize is, okay, there's going to be half of our students who are still at home and are seeing their peers come back into the building, and that has its own kind of social emotional strain associated. So any suggestion about how to navigate that for families?
Well, this is not easy, right? It's a tough time, and I think we want to be honest with our kids, not and answer the question that they're asking. I think sometimes we sort of maybe say or share too much. I think focusing on what we're doing to be safe. So they don't need to hear about the numbers and, but maybe saying that we are doing everything we can. We're wearing our mask, we're washing our hands, and that families make their different decisions. And it's totally acceptable that your friend wants to stay at home, that his mom and dad have made this, or parents have made this decision. And we decided that we're ready for you to go back, and you're ready to go back, and we're going to do everything we can to make sure we do that in the safest way as possible. And so, reinforcing what you're doing to help them feel safe, I think, is the best lesson about wearing masks, about social distancing. That's why you can't hug your friends yet, but you get to see them and you can talk to them. That's why you want to stay. You're 3 and 6 feet away, and why we're limiting where we're going on the weekends, and why we're limiting who comes to our house, and why we go see grandma and grandpa outside, things like that. And so telling what we can do and why we're doing this, and we're doing everything we can to be safe, I think, is the message that we keep telling our children.
Recognizing that, again, I would say for us in particular, we were already seeing some escalating concerns around mental health and wellness, just in terms of what we were seeing with our students. And that was prior to the pandemic. And obviously this has exacerbated that to a certain extent. One of our challenges was, well, also now we don't, at best, maybe we see them through a screen and maybe with the camera on. From the school's perspective, assessing the health and wellness and mental health of students virtually is really hard.
It is.
So some of that then, now falls to families. Actually, that was one of the main reasons a key reason we wanted to have students come back, particularly our younger students, was just our ability to check in with them on their wellness, because schools function in that role in a really important way in terms of assessing students' wellness. But in terms of guidance for families, in terms of, what to look for in terms of the potential mental health impacts, that they should, at what point should they reach out to you based on things they're seeing with their students in terms of wellness and mental health in the pandemic.
Right. Well, we are, it's one of the reasons we've been working really hard for the past year to encourage our families to come to see us, to why we pivoted to telehealth pretty quickly, so that we can have those conversations, to maintain those connections, and be able to see them through the screen at least, and then figure out how to bring them in the office safely. And it depends on the age of your child. A young child might just be having more tantrums, acting out, not sleeping well. Older children, not engaging with the family, wanting to spend more time alone, not doing the things that used to bring them pleasure, used to make them happy. Suddenly they don't want to play baseball with you, or they don't want to go for a walk. They don't want to play with the dog. They don't, those kinds of things would be really good, important signs to watch for. Anything in particular when it's preventing them from doing the things they really love to do, or being involved with the family, or seem to be distancing themselves, and just ask the question. I'm going to be sitting here on the sofa. You seem like you're really down. Let's, if you want to talk about it, let's chat, and we'll, call the pediatrician, and bring them in and see. We have screening tools and things like that to ask them to have the adolescents anyway fill out. And with the smaller kids, just engaging with them, asking them a few questions, and seeing how they're feeling.
I know one piece of advice that I had heard recently was if you can have those conversations when you're doing something else. So while you're like walking or cooking or something like that, so it's less of like, face-to-face
right.
contact, like we're having a conversation now about how you're feeling, and more,
right.
So forth. Is that made sense to me?
I love that.
That resonates with best practice as well.
Yes. When you're ever having those conversations about how you're feeling, or, I came home and slammed the door, or something's going on, I'm going to go work on some Legos, or color, or, go sit on the front porch and watch folks walk by and see what they, and they'll come join you. And that's exactly right. Start sharing things, taking a ride around in the car. I mean, it's funny what kids will say when they're in the back seat sometimes, and you're like, oh, what are you talking about back there? It's surprising sometimes. So having an ear out, that's a great advice when you're doing other things, and saying, for them to say, well, you know what I thought about the other day, or I had a funny dream, or whatever they might say, and then just listening out for those cues to pick up on. Yeah. I love that.
I know we're going to open up for questions in a few minutes, but other kind of topics that parents have raised in their conversations with you and so forth, that, we haven't kind of talked about yet. Anything along those lines that, again, frequently asked questions from families around this that we haven't covered?
I was talking with a family today about just how whenever there's a challenge, it's an opportunity for us to learn. And I think as parents, our jobs are keep our kids safe and, provide for them, but not to buffer all pain and all discomfort, right? We want them to learn to be resilient, and also to model for them and to teach them as we're going through life together about things. And so taking care of yourself, parents, it's gotta, if we're not in our thinking brains, we can't be creative and problem solving with our kids. And that means we have to make sure we're getting our rest and getting our support wherever we need to get it from, so that we can be there for them. And then model how, well, we can't do this, but what can we do, and problem solve with them when they're feeling good, when you're walking the dog or working on the Legos. I know you really wanted to go to camp this summer, and, we might be able to, but if we can't, what else can we do? Can we do something as a family? What would, something else we can do, and get kids to help you problem solve. But we can only do that when we're in a good spot. And so we have to be, keeping our routines, getting good rest, trying to keep our nutrition up, it's been a year where we all want to sit around and eat a lot of things and watch a lot of TV and that kind of thing. But I'm remembering, okay, let's try and take better care of ourselves and our families, and we can come out of this and with some wisdom. So.
I think that's a really interesting point that I know education has been grappling with, is this idea of learning loss versus the resilience that students are seeing. And this has been a really active conversation in the education field because there's, we don't yet know so much about where students are academically, because in many cases we haven't been able to assess them because we haven't seen them. But there's been a lot of framing it in terms of like dire consequences of learning loss. I think what we're starting to see now is also some sense of like, okay, well, they also may not have been learning all of the academic things that they normally would have learned at home, but they also were learning other things of value, and that there is potentially some resilience that might come out of this, and skills and so forth that students have learned. I mean, is that coming out in medical conversations too? It's a really interesting tension that we're seeing on education, in terms of just how do we frame what the impact of the pandemic is, and then also how do we frame our response to that? It's very different depending on how we look at what this impact has been.
Right. I haven't seen so much of it. I mean, I think just in positive parenting and discipline, we try to talk about learning from challenge and learning from mistakes and those kinds of things all the time. So I haven't seen that framed in that exact way. That's sort of fascinating that education is looking at that. That's amazing. I love that.
I know another question that came here and I saw in the chat was, how about navigating questions about why kids can't get the vaccine? We see here, why kids can't get the vaccine, especially now that adults are celebrating getting the vaccine. How about navigating that?
Right. Well, one of the things we love to say in pediatrics is that kids are not little adults. And so we need to make sure that these vaccines are safe and appropriate for their growing bodies and growing minds, and that they work. And so it's just, there are some kids getting it, and they are in studies, and that's what I would tell them, that they're doing with kids what they did with adults last summer, which is giving some of them the shots and seeing how they do. And as soon as we know that it's safe for you, we'll be offering it to them too.
Gotcha. Thank you. Looking at other questions that we have here. Also about how to talk to those who are home. I'm assuming this is kind of in reference to the students that are learning virtually at home, and that conversation. Seeing peers or hearing about peers that are in school. How would you approach that?
I had a great mom in the office the other day, and she was dealing one of your students, and he said, I really want to go back. And she said, I know. She said, this is, we have to do what's right for our family, and every family's different. And right now I'm more comfortable with you being at home, you and your sister being at home. And I think just, again, you're being honest, you're just saying it as simply as you can. But in a way, it's a positive way, just saying, I'm just, when I'm ready, and it won't be like this forever. We'll be able to go back. And what can there's just something you'd like to do? You'd like to send a message to, or write a letter, or video chat with one of your friends, and, an opportunity to connect, that maybe we can figure out a way. Can we go to a playground safely together, as the weather warms up? And what would you like to do when we can go back to school, and helping them forecast and think about when they will be able to go back? What are you looking forward to? And having those kinds of conversations too. Excellent.
I wonder also about thinking about going into the summer and into next school year, particular considerations in terms of, I wouldn't ask you to look into a crystal ball, but like thinking about, what we might expect out of the summer and what we might expect going into next school year. What are you seeing? I think certainly on the school side, the shifting guidance from the CDC in terms of 3 feet is acceptable, opens up. Again, we're in a hybrid model right now. We're in a hybrid model because when we decided to transition to in-person learning, the CDC guidance was still 6 feet. So we built a model around 6 feet. And now we're thinking, okay, we can now build a model potentially around 3 feet for next fall, which means potentially more students in the building, potentially more days of the week, and so forth. Right. So more of a return to in-person learning. What else are you seeing, in terms of the start of next school year? And then also we have this interesting time in the summer. Obviously, we'll be offering some summer programming just to kind of highlight the resilience and kind of, capitalize on that for our students in the summer. But considerations around that.
I just said it went right out of my head.
Nope.
Oh my goodness. I know. I was just thinking about, thinking about the crystal ball, how I was thinking a year ago, I thought, I stopped making predictions like in May because I just never would have thought that we'd be still doing this a year later. So, but there is some of the experts are saying we have good reason to hope that this summer will be much better than last summer. We'll still probably be wearing our masks and but able to be outside and do more things and see more people, and that we should continue to see community spread. And I didn't mention it, but when we were talking about how numbers are increasing, they're still a lot less than they were when we were at our big peaks last summer and earlier in this winter. So things are kind of going up and down, but still overall much lower than at the worst of it. And there's reason to hope that will continue. Our community spread will continue to decline this summer and by the fall. And so, as you said, I think the evidence is showing that we can now have students sit a little closer together, and that means more children can go to school. And again, not to get rid of all. There's nothing that will give them zero risk, but really mitigate as much risk as possible, and hopefully get them back to in-person learning.
Gotcha. I know there's another question here. Is there such a thing as over sanitizing, and should my student double mask? I know double masking, particularly in the conversation around the variants, has been. So what advice would you give around sanitization? Obviously is one of the key mitigation strategies, but also the double masking question piece.
So I think we've learned that you don't really have to worry about sanitizing your bags when they come home and putting them in a decompression zone or something like that. I think that you carry your bag in, you wash your hands after you've carried your bag, right? And so that in and of itself is going to really rid you of whatever might have been on your bag. But then 4 hours later, it's not, or however many, an hour later, it's not really infective later, but you want to just wash your hands, I think. And then as far as masks go, we want a well-fitting mask. And so one well-fitting mask is better than 2 ill-fitting masks. And so I think it's hard to imagine, especially young children, being able to competently wear 2 masks. And so the evidence right now is saying that really a well-fitting mask that your child will keep on and isn't constantly readjusting and falling off and touching his face and touching his eyes, like that's what we want. For your adolescents who can competently wear or even a mask that has the filters in them, so therefore it's they're one mask that has a little extra filtration and protection would be good, but it's better to have, like I said, one well-fitting mask than 2 poorly fitting ones. So just for the little guys.
Gotcha. And you mentioned that there was a kind of slight uptick in the cases after what we had seen was a really consistent decline. I mean, what do you attribute that to? Is that something that ultimately the rollout of the vaccines is able to address?
I'm not sure. I mean, we can definitely attribute the January peak to the holiday visits and travel and things like that. There's this increase now. I don't know like I said, I feel like it's spring and people are like, oh, everything's fine, and I'm just going to go outside. And you're watching the news, we see outside of at least outside of our immediate communities, people are still not being as reliable wearing masks and social distancing. And so you're going to have more community spread when that happens, unfortunately. So we just have to, where we can maintain our, the mitigation strategies and the things we know work, even against the variants, we will see the community spread decline.
Gotcha. Another question here on the screen about the safety of team sports, like soccer and baseball. We're now I know for us, we are in a spring sports season where all of those sports are outdoors. So that's helpful
Yes.
in terms of that. And again, I think, the summer camp question as well, what's the safety of those team sports, recognizing that probably some you can maybe wear a mask during, playing them, but maybe some you can't. I mean, and also even some guidance there about how much should you prioritize trying to wear a mask on a sport like soccer that might be more difficult.
Right.
Guidance there.
So the expert recommendation is really to wear your mask when you're on the sidelines, to focus a lot on when you're wearing a mask when you're doing your drills. With actively playing, there's some concern about actually getting sweaty or wet or something like that. Then it makes it more difficult to breathe through. And so there's right now the recommendation is to not wear them when you're actively playing on the field. And that we would basically be relying upon the participants in that sport, your teammates, to come when they're feeling well and not when they're not, or if they've had some exposure, then they're, to rely on them to stay home. I know more and more summer camps are opening and they're doing their own version, sort of like the school, where they're doing pre-testing and maintaining social distancing, sleeping, decreasing the number of kids in the cabin, in the cabins and the cottages and things like that. So making their own mitigation strategies to make it as safe as possible. And again, it's with all these other things, is weighing those risks with your families, about, how can we give our children some kind of experience, some kind of summer, but also, decrease some of the risks to our family. So.
And there was a specific question about sleepaway camp here. I mean, would you feel comfortable, sending your child to a summer sleepaway camp?
It would absolutely depend on the camp itself. Are they, some of the camps used to have 6 cabins or 6 beds in a cabin. Are they have they cut it down to 3 and spacing them out? Are they requiring masks and at the camp when they're indoors? Are they testing asking folks to arrive with negative tests? Are they testing their and immunizing their staff and their camp counselors, things like that? Can they keep the herd small so that they're, each cabin maybe only stays with itself and not with all the other dozen of cabins that are at the camp? And so obviously camps will have to change how they usually do things, but I think there are ways to do that again, we wouldn't get rid of all risk, but would seriously mitigate a lot of the risk for our students and our kids, so they can go and have some fun this summer.
Gotcha. Another question going back to sports here. So about, particularly about swim teams, particular perspective on that, different type of sport.
Yeah, swim teams are interesting because the chlorine helps and the salt water help disinfect. And usually now they're outside as the weather warms up, especially this summer. So wearing their masks when they're on the bench, but obviously not when you can't wear a mask when you're swimming. But I know we have patients who've been swimming all winter and doing it safely, with all the other factors, to keep it safe for them, for the teammates.
Gotcha. I know one other, going back to vaccinations and so forth, and the potential for children to get vaccinated. Are you hearing anything along the fronts about whether or not at some point that might be required? Do you anticipate that like a COVID-19 vaccine is going to be part of the, immunizations and so forth that we see for other, other illnesses?
It's a good question. It's up to that's a state government issue. I haven't heard anything about them taking that up in the legislature right now, so there won't be a requirement for the upcoming school year, and it's hard to imagine them doing it for, in time, even when it's the vaccine, if we have the vaccine next winter. Given that they don't require an influenza vaccine, it's hard to imagine them requiring a COVID vaccine. So I would be surprised if that becomes a requirement. But pediatricians and the hospital systems are all, strongly encouraging everyone to get their flu shots, as well as when it's time to get their COVID shots. For sure.
Gotcha. I know another thing that has been suggested is kind of taking natural supplements and other things that might boost immune system. Obviously, there's just a general concern about health and wellness, that you've kind of spoken about and so forth. Any recommendations of as a strategy and so forth that might be helpful?
There's some good evidence that vitamin D is helpful, especially in adults. So taking greater of 1,000 international units a day, particular for COVID-19. In general, I do like elderberry. I'm sort of become this elderberry person, although I just saw an article this morning about you have to be careful as elderberry becomes more popular, and problems with supply and supply chain. There have been some issues with adulterated elderberry, so it's not pure elderberry. So just being mindful of where you get it, and apparently elderberry grows in Atlanta, so you can make your own or grow your own in your own backyard. It'd be great.
Related to the vaccine as well, there's a question in the chat about do you expect folks to have to get the vaccine booster similar to the flu shot? I mean, also these questions about like how long are the vaccines effective? And so, adults now are, getting to the point where we're fully inoculated. But yeah, how long should we expect that to last? And when it wears off, what does that look like?
Right. So I think that is an emerging science. And so no one's really sure. There are some folks who are anticipating that there will be a COVID booster every year, and at least for the next few years, because of the variants. And I know the vaccine companies are continuing to look at how their vaccines stack up against the variants, and will they need to make a change in the vaccine or do a third, fourth booster to combat the variants. So and mutation is not that new. I mean, that's why we get a flu shot every year. So you're absolutely right. It's a good question, a good point. That and there may even be a situation where they could combine the two. And so we have certain vaccines where we get one shot that covers multiple diseases. And so I can almost anticipate there would be you get your flu and your COVID-19 every fall, but we'll see.
Gotcha.
Time will tell. Mm-hmm.
Indeed. I don't think there's any other questions in the chat right now. As we wait to see if others come in, I'd just make a plug. I think, as a school that just recently transitioned into hybrid, we're really excited about having been able to make that transition, and really, I think, seeing some great benefits from our students, their excitement. I think one of our students said, "Mommy, this is the day we've been praying for." Like, this is her first day coming to school, just to give some sense of how excited students were able to be back. And so far, we have, again, that layering of those mitigation strategies has really felt like we can really dramatically reduce the risk, both both the risk and the sense and the science that we're seeing about, okay, actually really the concern in schools is the adults. So now that, all Drew staff have had access to get a vaccine.
That's great.
And so that's addressing it with adults, and the spread among students is really limited. So I will just make a plug for families out there. Again, obviously you have to weigh those decisions and risks as a family. But as a school who's recently made that transition, I think we felt very, very confident and very happy to have those access to students, and again, we've appreciated and seen the benefits of that. So I hope that gives some folks some confidence from the medical perspective, and then also from the school perspective, I think there's a lot we'll be able to do with those students, even 2 days a week for the remainder of the year. That is significant.
Are you going to be able to have graduation? I know one of my mentees is a senior.
Oh boy. Yeah,
I'm sorry, put you on the spot.
Yeah, that's a hot button question right now. Yeah, we're working on graduation. Last year was, for the class of 2020, was challenging because it was still early on. We knew so little.
Right.
And so we were able to facilitate some senior activities for those students that had a great drive-through experience with their senior pictures up, and we're able to celebrate them from a distance. So we're looking at graduation options, and it is just trying to follow the public health guidance and balance the desire to honor those students and also, again, be safe and responsible for that. So we're working on that, absolutely. So it's exciting to think about getting back to some of those events in some fashion. There's just only so much you can do in Zoom to connect in some respects. So
yes.
So all right. Well, I think let's see here. I think we're done. So unless there are any other questions, I think just want to really appreciate your time. It's been great to talk to you. I hope this was helpful for families to get this advice. And so thank you so much for your time personally as well. I'm excited to.
You're welcome.
Always back with you, and take care, and hope everybody has a great evening, and take care, be safe, and be well.
Yes, be safe, everybody. Thank you. Wash your hands, wear your mask.